afternoon, everyone. I'm Diana Lau, and I'm Director of the Asian Health Institute, and I welcome all of you to this Stroke Symposium, the second part. 歡迎各位參加我哋今日嘅網上亞裔中風講座第二部分。咁咧就希望大家會鍾意我哋今日嘅講座。So without further ado, since we are running a couple of minutes late and we're tight in time, I'm going to introduce our Dr. Anthony Kim. And Dr. Kim is our director of this Comprehensive Stroke Center at UCSF. And today he's going to be introducing the speakers and answering your questions and so on at the end. And this is the agenda for today. We have three sets of speakers today. And the first one is the paramedics and the firehouse staff at San Francisco Fire Department and the Emergency Medical Services. And then we have Dr. Jessica Lee and Gina Yam from Chinese Hospital. And then we'll have Dr. Randy Higashida from UCSF, our radiologist professor. So without further ado, Dr. Kim, I'll turn it over to you.
Thank you, Diana. I first want to say that this series, this is, as most folks know, this is the second of three sessions. And I think it's so important that we have this outreach to the Asian and Chinese American community. I'm very happy for this relationship between UCSF and Chinese Hospital to further the improvement of stroke care for our patients. And we have a few great presentations scheduled this afternoon, and then hopefully we'll have some time for a question and answer at the end.
咁咧金醫生咧，金醫生係韓國人嚟嘅，咁佢哋係佢就係我哋呢個綜合中風中心嘅主任啦。咁金醫生咧就話我哋而家咧其實係同喺三藩市嘅東華醫院咧有一個合作嘅計劃嘅，係照顧中風嘅病人。咁咧就金醫生咧就話佢好高興有呢個計劃係可以等我哋可以對中風病人嘅照顧更加細微啦。咁就佢話今日呢個講座咧係一個應該係一個非常之好嘅講座，就希望大家拭目以待嚇。
The theme of the session is pre-hospital treatment in the emergency department, and then we'll talk about treatment in the hospital. So it's the entire chain of care for stroke patients.
咁首先咧，我哋就會講今日咧就會講係未入醫院嗰個部分，即係你仲喺屋企嘅。咁然後咧就跟住講醫院嗰部分。Okay.
So I'm pleased to introduce Doug May, a firefighter and paramedic with San Francisco Fire Department, and Ada Wong, a rescue captain with Emergency Medical Services, which starts this whole chain of care for stroke patients.
咁咧，我哋好多謝今日Douglas 同埋Ada 呢兩位前線人員啦，係同我哋今日嚟到講佢哋喺人哋打咗911之後咧，佢哋用救傷車去到病人屋企嘅時候，佢哋所做嘅工作。
Hi, good afternoon. My name is Doug May. I'm a firefighter paramedic with the San Francisco Fire Department. My firehouse is in Chinatown, actually on Powell and Broadway. Thank you for having us here, along with my colleague Ada Wong. So today we'll be talking about what a stroke is, how to recognize its signs and symptoms, and when to call 911 and why it's so important to call 911 once you recognize that it may be a stroke.
So 德咧就係我哋嘅消防員嚟嘅，佢嘅工作地方咧就喺華埠拋街嗰度，大家都知道嗰間消防局嘅。咁咧佢其實而家係上緊班嘅。咁喺上班嘅時候，因為可能冇人火燭啦嚇，咁佢而家咧就係同我哋做呢個講座，我哋好多謝德嘅。咁咧德咧就話佢咧咁今日會同你哋講話即係點樣係中風中風嘅症狀啊，同埋叫911嗰啲咁嘅，呢啲嘢咧其實係上次嘅講座已經係講咗噶啦。咁咧就不過咧，因為今次嘅參加人士咧，你哋亦都未必係定係上次喺度，所以同你哋重提一次。但係咧亦都會加啲佢哋消防員對去到個病人屋企嘅時候，佢哋會做啲咩嘢嘅。
As you guys discussed earlier classes, a stroke is when there's a sudden, the blood flow to your brain has stopped when there's a sudden blockage. It may be caused by a clot or a bleed. So when this happens, the brain tissue doesn't have any oxygen and will begin to start deteriorating or die. So one of the very common symptoms is a bad headache or a sudden confusion.
咁咧，阿德咧就話咧，再講一講係中風到咧係咪中風咧？中風咧係有可以係兩個原因其中之一。一個咧就係期血管塞咗，即係個腦裏邊嗰啲血管塞咗；另外一個咧就係個腦裏邊嗰啲血管爆裂，我哋所謂嘅講嘅爆血管啊嚇。咁咧兩個咧都會令到我哋嘅腦細胞咧係缺氧嘅，即係條血管一係塞咗，一係爆咗，咁啊啲血咪去唔到佢個受傷嗰個部位之後啦，係嘛？咁咧所以咧就係睇個腦邊一個部分係冇血到啦，咁嗰啲症狀咧就會出現啦。咁咧佢其中好多時出現嘅一個嘅兩個嘅症狀咧，就係嗰個無名嘅頭痛啊，係無端端個頭痛到好似爆咁樣樣嘅，係好犀利嘅頭痛。同埋一個咧就係突然間個人好似懵咗咁，即係混混淆都唔知即係自己喺邊啊，又唔知做緊咩嘢啊，連個名都可能唔記得啊，又唔知你係邊個咁，即係嗰啲咁嘅症狀咧係突然間出現嘅，而係好犀利嘅。咁嗰啲如果你見到咁嘅情形咧，係好可能係同個中風有關，即係整面嘅個腦嗰度有問題咯。
Okay, so once we get on scene, well, one of the first things we do is we want to get a good story, whether it's from the family or friends or whomever is calling 911. So if we recognize that it may be a stroke, the person's maybe experiencing a stroke, whether they're complaining of a very bad headache, or the person calling 911 is saying, hey, this person all of a sudden cannot speak or is weak or confused, we do a stroke test. Maybe have them smile or show us their teeth, raise their arms up, see if they're able to raise them up, same strength, equal strength. Have them repeat some words, and we check on their speech.
阿德咧就係話咧，如果你係即係各位朋友喺線上嘅朋友，如果你係當時係同埋嗰個病人喺埋一齊嘅咧，你就要留心一啲嘢。第一就係個時間，你要睇下鐘，而家幾點鐘，佢係發生呢啲咁嘅事。係發生咗咩事咧？睇下佢嘅咩症狀，佢係唔講到嘢啊，又話係睇唔到嘢啊，又話係隻手用唔到啊，又話係乜嘢事咧？你要留意佢，即係個時間係非常非常之重要嘅。咁然後咧就即係我哋呢個咧就係be fast BEFAST 呢個咧就係腦中風嘅症狀嘅通常嘅症狀。咁咧我哋咧就通常咧佢哋之前咧就講 FAST 嘅 FAST 嘅，咁咧就中文咧就譯做談笑用兵。點解談笑用兵咧？談咧就口講啦，即係你可以叫個病人，如果你覺得個病人有啲唔錯嘅時候，你可以叫佢講下嘢，睇下佢係咪口齒不清啊，或者嘰聲啊，都唔知講乜啊咁樣嘅。OK， 笑咧就叫佢笑，佢笑嘅時候咧就塊面咧你就睇佢有冇歪啦，即係一邊稱低。一邊稱高咗，一邊咧就唔喐嘅咁。OK， 用咧就係用隻手。OK， 就係兩個手叫佢擺喺前面嗰度，睇下嗰兩個手會唔會係一直高一直係維持喺高個位，另外一隻咧就一路咁垂低一路跌落去嘅。咁然後咧兵咧就談笑用兵，兵咧就係叫你去叫救兵啊，打911啊。OK， 咁咧之前咧就係 fast 嘅 BAST 嘅，但係後尾咧就加咗兩個喎，一個咧就係平衡啦。balance 嗰個人咧就行路嘅時候咧，佢會跌埋一邊啊，可能即係可能隻腳腳遠，一邊隻腳遠嘅。咁另外一個咧就係 eyes 隻眼 ，OK， 咁咧就係可能一邊突然間睇唔到啊，或者係即係睇嘢蒙查查啊咁啦。咁咧所以咧我哋而家係加多4個字，就叫做平衡眼睛，然後就談笑用兵。咁呢個就係我哋嘅中文嘅翻譯啦。OK， 所以你記住呢8字真言就係。平衡眼睛，談笑用兵。到時你覺得如果個病人可能中風喎，唔知係咪咧嗰陣時咧，你就記住呢8個字，咁就叫佢做啲嘢，咁你就知道哦，真係可能係喎。跟住最重要係咩？即刻打911。
So treatment is very limited for us in the pre-hospital setting for people who might be experiencing a stroke. But what's most important for us is getting the accurate information, meaning whether you get it from the medications that you see the person is taking, the person that is calling 911, if the person experiencing the symptoms is still able to communicate. We ask them, hey, when was the last time you noticed yourself normal? Or ask the bystanders or family, when was the last time they were very last seen normal? Or if they just woke up started having these symptoms, or hey, when was the last time you went to sleep? Any previous strokes, getting a good history, the exact symptoms, because within that time, that allows us to relay the information to the hospitals and the staff in the hospitals so they could get treated appropriately.
咁得咧就話咧，即係我哋咧救護人員咧到達咧嗰陣時咧，就喺好少時間內咧就會做好多嘢嘅。咁咧最重要咧就係我哋會問好多問題關於病人嘅。咁例如咧病人最後一次最開始見到病人開始出現呢啲中風嘅病徵係幾時？係咪1個鐘頭前啦、5分鐘前啦，定係尋晚瞓覺之前？我哋都想知道病人最後一次見到係即係正常嘅話係冇病徵嘅係幾時？係咪尋日晏晝啊？瞓覺之前啦，定係5分鐘之前？呢啲資料都好重要嘅。咁除咗問題之外，我哋亦都會問病人關於譬如病歷啊，有冇曾經中過風啊，有個心臟病發啊，有冇糖尿病啊，甚至仲有同埋資料關於有冇平時食開啲咩藥物啊，咁呢啲全部加上檢查病人嘅血壓啊、血糖啊，同埋做心電圖。呢啲嘢全部咧，救護人員咧都會好快喺好短時間之內做嘅。咁如果我哋可以將所有呢啲資料咧，一齊拎攞埋去到醫院度交俾醫生護士啦，咁就會可以盡快幫到病人噶啦。
So after we get all the information, we want to make sure we take the person to the appropriate facility. There's many hospitals in San Francisco, but not every hospital has the capability to able to accept stroke patients. So we want to make sure that once we get all that information, we take them to the closest and most appropriate facility that can accommodate these stroke patients and explain to the family members or the friends or people there, and even to the patients, maybe they want to go to one particular hospital, but we need to explain to them, say, given what we find, that is most appropriate that we take into a specialty care facility. So again, that comes with reducing the amount of time is wasted on scene and the onset of the symptoms, and so they could get the most appropriate care.
有時候咧，咁我哋檢查完病人啦，攞咗所有資料之後咧，咁決定病人係可能有中風嘅中風嘅可能性咧，我哋就會即刻帶病人去醫院。咁有時候咧未必可以帶到係你平時去開嗰間醫院嘅。三藩市咧有好多間醫院，但係有唔係間都可以幫助中風嘅病人嘅，所以咧有時候未必可以去到你平時去開嗰間。咁咧如果有時候病人情況好危殆啦，我哋可能要去最近嗰間醫院，未必可以去到你即係你譬如你係你驗疏包嗰間醫院，但係咧因為時間係好重要，所以一定要去最近嘅醫院噶啦。So the most important thing for everyone to remember is if you have any signs and symptoms of a stroke, and when we mean signs and symptoms, we mean BFAST, BEFAST, then the most important thing is to recognize this and call 911 immediately, because we need to get the patient to the hospital. 咁大家要緊記，最重要咧係當你遇上有病人遇到你啊或者身邊啲朋友咧感到不適而有以下嘅病徵嘅話咧，就請立即打911。OK， 多謝晒。
Thanks so much. The pre-hospital care of stroke patients is so important. One of the things I might share is before I went to medical school, I was trained as an EMT. So the role of the pre-hospital care is very close to my heart.
咁啊，金醫生咧話佢未曾做醫生之前咧，佢係曾經係做過呢個急救員嘅，所以佢係講呢部分嘅時候咧，佢真係覺得係佢心有同感咯。
So now we'll switch to the next component of care for stroke patients, and that's treatment in the emergency department. I'm pleased to introduce Jessica Lee, the director of the emergency department at Chinese Hospital, and Gina Yam, the vice president of operations at Chinese Hospital. And again, as you know, there's a relationship between UCSF and Chinese Hospital to provide care for stroke patients. And so we're pleased to collaborate on this important mission.
Good afternoon, 各位你好. My name is Dr. Jessica Lee. 我係李醫生，我係東華醫院急症室嘅醫療總監。So I am the medical director of the emergency department at Chinese Hospital, and today I'll be talking to you about stroke care and stroke treatment in our emergency department. And Gina Yam, our chief of operations, will be translating for me today. So thank you, Gina, and let's get started.
大家好，我係東華醫院嘅高姑娘啊，咁我今日就會為李醫生咧進行一個翻譯嘅，咁我哋最後尾咧亦都會有呢個問題時間，咁我哋就而家就開始啦，有請李醫生。
This is a picture of the Chinese Hospital Emergency Department, also known as our ED or ER. And this is where you will be receiving a lot of your stroke care. When you get here, you'll probably be asking, well, what will happen to me now? So during this portion of the talk, I will go over what you can expect if you present to our emergency department with a possible stroke. So you will be arriving either via ambulance or on your own. And if you've called 911 and are coming in by ambulance, then we will have already been notified by EMS, and so we will be ready for you. Now, if you are presenting on your own, then you will be greeted and triaged by our staff who are trained to rapidly recognize your symptoms, and they will get you roomed and seen as quickly as possible.
咁呢個鏡頭面前咧，就見到我哋而家係東華醫院嘅急症室啦。咁大部分中風嘅治療咧，都會喺我哋急症室裏邊進行嘅。咁我哋今日咧就講一講喺急症室裏邊究竟會發生啲咩事情咧？我哋嘅醫療人員係點會幫助你咧？咁如果你係911又或者係把車送入嚟嘅話咧，咁我哋其實事前已經知道你會嚟㗎啦。咁其實我哋工作人員咧已經準備好你嘅來臨，所有嘅中風程序已經開啟咗㗎啦。但係如果你係自己嚟嘅話咧，我哋工作人員咧就要好快咁去識別究竟你係中風啊定係其他嘅問題。咁當如果你係中風嘅時候咧，我哋就會即刻進行我哋呢個中風嘅protocol 啦，即係我哋啟動我哋嘅程序嘅。
Your initial evaluation in the emergency department will consist of the following. So first, your doctor will check your airway, your breathing, and your circulation to make sure that you're able to talk and breathe and make sure you have pulses. And then your nurse will be obtaining your vital signs. So we will be checking your temperature, your heart rate, your blood pressure, your oxygen saturation, and your respiratory rate. We will want to know exactly when your symptoms started, and we will want to know what time you were last known well. So basically, we want to know the time when you last had no signs or symptoms of a stroke. And this is very, very important because if your stroke symptoms started within 24 hours, then there are certain medications and acute treatments that we can consider. And your doctor will perform a physical examination, including checking your heart and your lungs, and of course, perform an in-depth neurologic exam.
當你嚟到我哋急症室嘅時候咧，我哋第一樣要做咧就係要 make sure 你有 ABC， 即係話咧你嘅氣道要係舒暢㗎啦，你呼吸正常，同埋你血液循環咧都係正常嘅。然後咧，我哋會 check 你嘅維生指數啦，睇下你心率啊、心跳啊正唔正常，血壓、體溫、血氧裏邊嘅含氧度，即係你嘅呼吸啊，你嘅氧氣能唔能夠正常去到你嘅血液裏邊咧？而最重要嘅咧，我哋係要知道究竟你係幾時開始中風呢個症狀，又或者調翻轉嚟講，即係你對上一次正常嘅時間係幾時？通常你自己或者你嘅屋企人咧，就會幫我哋解答佢呢個問題啦，即係我聽，佢9點鐘食早餐嗰時仲係正常嘅，咁呢一個咧就會係你嘅叫做 last known well， 最後一次沒有中風嘅時間。咁之後咧，我哋就會進行呢個詳細嘅身體檢查啦，睇你心臟、肺部同埋其他神經狀況咧係有冇正常嘅。
Okay, so this is a very busy slide, and it's only meant to show you what our stroke assessment entails. So your doctor and your nurse will be asking a lot of questions while examining you. And what we are utilizing here is the NIH stroke scale, which is a 15-item scale to determine how severe your stroke is. It helps us assess a number of things. It helps us assess your level of consciousness, your language, your vision, your motor strength, your sensory loss, your coordination, and your speech.
喺前面咧就係呢個美國國家衛生局嘅腦中風評估表，佢總共咧係有15項嘅。咁呢15項咧其實係評估一下你嘅意識啦、語言啦、能力啦、動作啦、感覺有冇受損啦、協調有冇受損啦，同埋你嘅講嘢嘅能力。咁從而咧係決定咧你有冇中風呢個問題嘅。
All right, so once your doctor determines that you are having a stroke, then he or she will activate a code stroke. And so a code stroke is our emergency process for treatment of acute stroke patients. So once this happens, many different hospital personnel will arrive to the emergency department to assist in your care. And this includes a lab technician to help draw your blood, a pharmacist to assist with medications, a house supervisor who will help organize your care and coordinate teleneurology services with UCSF, a respiratory therapist who will help with your airway and breathing and your EKG, a CT technician who will help get you ready for a CT scan as soon as possible, and our in-house hospitalist who will be your doctor when you get admitted to the hospital.
當我哋急症室嘅醫生決定咗呢一個係一個中風嘅個案嘅時候咧，我哋就會啟動我哋中風嘅程序、中風嘅步驟嘅。咁當呢個啟動咗嘅時候咧，其實我哋好多醫院嘅人員咧就會直接去到呢個急症室。咁包括啦，我哋有我哋抽血嘅人士啦，我哋有藥劑師去準備抽藥啦，我哋有急症室嘅醫生啦，我哋會有一個遠程嘅專科醫生啦，我哋有呼吸治療師，同埋我哋會有我哋嘅 CT 人員，即係譬如話佢哋要幫你照呢個電腦斷層嘅話咧，都會即刻趕到去我哋嘅急症室去幫助你嘅。咁當日嘅駐診醫生咧就會係你嗰日嘅醫生啦，呢個個案嘅醫生啦。
So many different things will be happening all at once. You'll be changed into a gown. You will be placed on a monitor where we will continuously check your heart rate and your vital signs. We'll take your weight, and your nurses will be placing 2 peripheral IVs. Meanwhile, a CT technician will be preparing the CT scanner so that you can get an immediate CT scan of your brain. We will also be obtaining blood tests, including your blood sugar level, and an EKG will be performed after your CT scan.
當然好多嘢都同一時間發生緊啦，因為我哋想喺最快嘅時間去幫助你解決到你嘅中風嘅問題。咁護士咧就會即刻同你換上病人袍啦。咁我哋會連接呢個監察器嘅，去監察你嘅叫做 vital sign 就維生指數。咁我哋嘅護士咧都會同你量體重啦，因為對於我哋血液注射係非常之重要嘅。咁你亦都會同時咧會有2條嘅靜脈嘅導管啦。當我哋如果係要注射藥物嘅時候，就會需要用到啦。咁我哋嘅電腦斷層掃描咧，亦都會為你準備好啦。我哋希望45分鐘之內係做到呢件事嘅。咁而家血液檢查啊，或者一啲血糖嘅水平啊，我哋都要肯定咧係正常嘅水平，我哋先可以繼續去進行呢個嘅治療嘅。咁同時咧，我哋做完呢個電腦嘅斷層嘅時候咧，亦都會 check 下你嘅心臟啦，睇你心電圖係咪正常嘅。
One of our main goals is to get you to the CT scanner as quickly as possible to obtain an image of your brain. Our radiologist will review your image and call the ED doctor immediately with your results. And all of this will happen, as Gina mentioned, within 45 minutes of your arrival to the emergency department. And what we are looking for is a brain bleed or a brain mass or another non-stroke cause of symptoms. Please note that a normal head CT scan does not exclude an acute ischemic stroke. And I'll show you some pictures next.
見到咧就係一個叫做 CT 嘅 machine， 即係我哋嘅電腦斷層嘅機器，係幫你照一照腦裏邊咧，睇下有冇呢個出血嘅狀況。首先我哋第一步咧就要肯定你係冇腦出血嘅時候咧，我哋先至可以決定其他嘅治療方案嘅。咁但係咧好多病人入到嚟，其實咧可能係一照 head CT 個腦斷層咧係正常嘅，但係一個正常嘅腦斷層掃描咧就唔代表你係冇一個急性嘅缺血性中風嘅可能性。咁我 Dr. Lee 就會慢慢再講多一啲。
So here is an example. This is the image of a pretty normal CT brain with just some minor early parenchymal changes. So here you can't tell that there's a stroke going on.
呢個咧就係一個中風病人啱啱入到嚟醫院嘅電腦斷層掃描。一開始嘅時候咧，其實腦裏邊嘅變化咧唔係好多㗎。
see here, this is 2 days later after the patient has been admitted to the hospital for stroke. This is what the new CT image looks like. So here you can see the findings of a stroke in the dark gray and black area. That is the area of the stroke that was not present on the initial CT scan.
咁依家咧，你就會睇翻同一個病人入院之後2日，你就好明顯見到佢嘅腦嘅電腦掃描咧係好唔同嘅。咁所以就證明咗咧，入到嚟嘅時候同埋2日之後，就算係同一個病人，其實個腦掃描都好唔一樣。
And here is a different patient. So this CT scan shows a brain bleed, bleeding in the brain on arrival to the emergency department. So as you can see, the bleed is bright or white on the CT scan during the acute phase, and over time it will darken.
而呢一個咧就係另一個病人嚟嘅，而呢一個咧係一個出血性嘅中風。咁你見到白色嗰度咧，其實就係佢出血嘅狀況啦。而呢一啲出血嘅狀況咧，其實如果之後再照嘅話咧，就會慢慢變暗㗎。
As you've heard, Chinese Hospital has partnered with UCSF Teleneurology to provide you 24/7 access to a neurologist or stroke specialist who will help guide your stroke care. And your ED doctor will be in close communication with this neurologist who will also evaluate you via a teleconsole, similar to a large TV screen or iPad, which you can see here in this picture. And so this way you will be able to see and talk to your neurologist who will be able to examine you. And there will be more to come on this during next week's session, so please stay tuned. And your doctors will be discussing your treatment options, one of them being TPA, which we'll discuss on the next slide.
喺呢張相度咧，就見到咧，我哋東華醫院其實係同 UCSF 咧好榮幸咁有呢個嘅遠程嘅神經科醫生合作嘅。咁你見到佢喺電腦度咧，就會經過呢個電視視頻啦，又或者經過一個 iPad 咧，就會直接幫我哋喺東華醫院咧見我哋嘅病人嘅。咁呢個專科醫生咧就會決定究竟呢個病人嘅主要治療方案係點樣做啦，究竟需唔需要打一啲溶血性嘅藥物啦。咁好多嘢咧都會同我哋嘅急症室醫生咧係隨時不停咁樣去 update 去聯絡，而決定我哋呢個病人呢個 case 係應該點樣處理嘅。咁我哋下一個禮拜咧 ，Dr. Lee 咧亦都會其他醫生咧亦都會講一講咧，究竟呢個程序係點樣做嘅。如果你係有興趣，下一個禮拜可以再繼續睇我哋。
So TPA, TPA or alteplase, this is a medication that is used to treat a stroke. It is a thrombolytic drug, sometimes called a clot-busting drug, because it helps break up blood clots and restore blood flow to the brain. And it's a medication that is prepared by our pharmacy and given intravenously. So your doctors will determine whether you are an eligible candidate for this medicine. If you are 18 years or older and you're having a stroke and you have no bleeding in your brain, and most importantly, if you present within 4.5 hours of symptom onset, then you are an eligible candidate for this medication. However, there are multiple exclusion criteria as well. So for instance, if you have active bleeding in the brain or somewhere else in the body, or if you've had a recent brain or spinal surgery or serious head trauma within 3 months, or any other conditions that increase the risk of bleeding, like certain brain tumors or aneurysms or bleeding disorders, or if your blood pressure is severe and uncontrolled, then you will not be eligible for this medication.
咧中文就叫替普酶啦，咁其實咧單人嗰隻叫做 TPA 啦。TPA 咧係一個血栓嘅溶解劑嚟嘅，真係將可以啲塞喺血裏邊嘅嘢咧，將佢溶解咁啊通翻條血管啦。咁佢咧主要咧係俾18歲以上啦，有中風啦，但係冇大腦出血嘅人用嘅。咁呢一個咧最重要嘅咧就係一定要喺當你出現症狀4.5小時之內先可以俾，過咗4個半鐘頭之後咧，就已經係未必會有最大嘅幫助。咁所以點解我哋講咗咁耐都係要最緊要係快去到醫院咧？就係因為呢個原因啦。如果你合乎晒你呢啲資格咧，你先至可以攞呢個藥嘅。但係咧，其實有好多情況呢個藥咧都係未必可以俾到。即係譬如話咧，大腦或者身體有其他地方係出現一啲嚴重嘅出血啦，又或者係做過一啲背脊啊嘅脊柱啊，或者啲腦部嘅手術，或者最近3個月裏邊咧係有嚴重嘅頭部創傷咧，又或者其他嚴重出現嘅問題啦，其實都未必係可以打呢啲嘅藥嘅。咁最緊要就係嚟到嗰陣時咧，要同醫生解釋清楚你自己最近3個月有冇咩其他身體狀況，又或者係我哋幫你 check 血壓嗰陣時咧，亦都要 check 清楚，要 make sure 咧你係真係可以攞呢隻藥，因為佢係太多好處，亦都係有唔好處嘅。咁下之後咧，我就會講下佢哋好處同唔好處啦。
So here we're discussing the risks and benefits of this medication. So studies show that patients who are treated with TPA are, number one, discharged home earlier. Number two, they are more often discharged home rather than to a nursing home. And number three, they report a better quality of life. Also, there is a significant increase in the percentage of those who are neurologically normal 3 months later. And the sooner TPA is given, the more benefit is derived. But as with any medication, there are both benefits and risks. And the major risk of TPA is bleeding, particularly bleeding inside the brain. And studies have shown that there is anywhere between a 3 to 6% increase in non-fatal brain bleeding. And there can be bleeding in other parts of the body, like GI bleeding or genitourinary bleeds or nosebleeds, et cetera. And other risks include allergic reaction and rash and bruising. And we will be monitoring you very closely during and after TP administration.
有證明呢個血栓溶解劑咧係可以幫助到病人早啲出院嘅，而且病人唔單止係早啲出院，而出院係可以翻屋企，係唔需要去療養院，咁就從而咧係可以大大咁提升呢個生活嘅質素㗎。咁研究亦都顯示咧，3個月之後咧，神經功能回復正常嘅病人咧都係顯著咁增加嘅。咁所以越早使用呢個血栓溶解劑嘅話咧，病人得到嘅得益咧就越大啦。咁但係其實任何藥物都一樣啦，有好處亦都有壞處嘅。咁呢個血栓溶解劑最大嘅風險咧都係出血啦，尤其喺腦裏邊嘅出血啦。研究亦都指出咧，啲非致命性嘅腦出血嘅風險咧，亦都會增加3% 到6% 嘅。而其他身體部位亦都有可能出血，譬如話腸胃啊，又或者尿道啊，又或者鼻。其他風險就可能會包括一啲過敏啊、皮疹啊，或者乳青嘅副作用啦。咁接受呢一個血栓溶解劑嘅時候咧，醫生我哋當然會好密切咁留意同觀察病人嘅情況嘅。
So we will be carefully managing your blood pressure, whether or not you receive TPA, and we have very specific blood pressure goals and medications to treat your blood pressure.
無論病人咧有冇接受呢個血栓溶解劑咧，醫生其實我哋都會好仔細咁去監察病人嘅血壓嘅。我哋亦都有特定嘅血壓標準啦，同埋藥物啦去控制病人嘅血壓嘅。
And if we determine that the cause of your stroke ends up being a blood clot in a large cerebral artery in a certain part of your brain, and if you're presenting within 24 hours of symptoms, then you may be a candidate for something called endovascular therapy or clot retrieval. And so you will be transferred to UCSF for this procedure. And this is the next portion of our talk. So I will be handing it over to Dr. Randy Higashida.
如果我哋確定咗你中風嘅原因係一啲大腦裏邊大動脈嘅血塊嘅話咧，咁你就可能會係轉去 UCSF 醫院，因為咧如果你呢個血塊或者呢個症狀係24小時內出現咧 ，UCSF 咧係可以透過一個動脈嘅手術咧，而幫你將呢個血塊拎出嚟㗎。咁有關呢個手術咧，咁我哋就會由下一位醫生啦 ，Dr. Higashida 去為我哋慢慢咁解釋嘅。
Thank you very much for your time, and we'll save questions for the end. Thank you.
Yeah, I am pleased to introduce Dr. Randy Higashida, who is Chief of Neuro Interventional Radiology at UCSF and a real leader and pioneer in the field of stroke treatments, endovascular stroke treatments. And he'll give a presentation on the state of the art when it comes to endovascular care for stroke.
Thank you very much. So I will be sharing our experience on state-of-the-art treatment and endovascular care if you present with a large vessel blood clot in the brain and how we treat you in the hospital with endovascular therapy. There are 6 full-time neurointerventional radiologists both here and at San Francisco General Hospital, and we offer this type of coverage 24/7 for any acute stroke treatment. So in terms of stroke statistics in the United States, we now know that there are 800,000 new patients that present annually with an acute stroke. Of these cases, 600,000 will present for the first time with a stroke, and 200,000 will have a recurrent stroke with a prior history of prior TIAs or stroke. Strokes result in 130,000 deaths per year, so stroke is a leading cause of death. 1 in 20 deaths in the United States are due to stroke. There's 1 death every 4 minutes, and the annual healthcare cost for stroke now exceeds $60 billion. Stroke is the #1 cause of serious long-term disability. Stroke is now the 5th leading cause of death in the United States. It can occur at any age. 34% of stroke patients are younger than 65 years of age. The risk factors for stroke include high blood pressure, high cholesterol, smoking, and we now know that patients who arrive to the emergency room within 3 to 6 hours of stroke may have less disability if treated appropriately.
各位朋友，呢個就係美國嘅中風嘅統計數據啦。咁咧其實嗰張 slide 嗰度咧，大家都睇到嗰啲字㗎啦。咁就係當然非常之多人有中風啦。就係一年咧有成60萬個新症，而復發嘅中風咧個人數咧都有成20萬嘅，咁係非常之多人。咁呢個咧係喺20個人之中咧係有1個人死於中風嘅，同埋咧每4分鐘咧就係1個人死於中風嘅，咁所以係好多人有中風。醫療費用咧非常之昂貴啊！我哋講60個 billion， 係一個好大嘅600億嘅數字啦，美金。咁然後咧就係佢最弊咧就係一個中風咧係可以導致長期殘疾嘅首要嘅原因嚟嘅，咁所以係唔係淨係中風嗰陣時病嗰陣時咁簡單，就係中風完咗之後咧係殘疾嘅時間咧，可能係長期嘅到死嗰日為止嘅，可能係咁，係美國嘅第5大嘅死亡原因啦。咁同埋係任何年齡都可以發生嘅。其實而家中風咧喺亞洲人嚟講咧係年輕化嘅，咁咧就係有34%，即係有成多過1/3嘅人咧嘅中風咧係都唔夠65歲就已經中風噶啦。咁中風好多原因啦，就係不受控嘅高血壓、不受控嘅膽固醇同埋繼續抽煙，就係呢啲嘢咧，通通都係可以控制到嘅。但係咧就係做得唔好，所以就會有中風啦。咁然後咧就中風之後咧有個黃金嘅時段嘅。如果呢個黃金嘅時段去到急症室咧，即刻打911，即刻去到急症室咧，係可以有辦法正如正話李醫生同你哋講咁樣，係有辦法可以幫到你哋係將呢個甚至將成個中風還原嘅，即係當係。即係可以係冇件事咁樣嘅，唔需要有殘疾嘅。但係呢個時間咧就係要把握得非常之好，因為你只有3個鐘頭至6個鐘頭嘅時間喺中風之後，咁係非常之快嘅嗰啲時間覺得。
So worldwide, in terms of stroke, we now know that stroke is a growing global epidemic.
咁我哋以為呢個我哋而家呢個新冠肺炎係流行病，原來即係呢個中風嘅流行病咧係可能已經俾人遺忘咗啊！俾呢個新冠肺炎而家係冚過咗，但係大家都唔好忘記，呢個中風仲係日日都喺度陪住我哋嘅，即係好多人日日都有中風嘅。
1 in 6 people worldwide will have a stroke in their lifetime.
可以講咧，係每6個人之中啊，就有1個人咧喺佢生命之中咧會有個中風嘅。
15 million new strokes occur each year worldwide.
全球嚟講咧，係有1500萬嘅人有中風嘅新症。
There will be 6 million deaths annually from stroke.
咁我哋知道新冠肺炎死幾多人啦嚇，但係呢個中風咧都唔少喎，係有600萬人一年有600萬人因為中風死亡嘅。
And there are currently 30 million stroke survivors with disabilities.
呢個就係最慘啦，係有3000萬嘅人啊！而家咧佢中風咧係個受害者啦，但係中風完咗之後咧，佢係仲係有呢個中風遺留嘅症狀咧，係即係唔係完全復原嘅。
There is a disproportionate burden of stroke in developing countries and in Asia, which include China, Japan, and Korea.
咁其實就係講全球都有中風啦，就算你係發展中嘅國家或者係已經發展咗嘅國家，以前就話中國係發展中嘅國家，而家中國已經係發展得非常之好嘅國家咧，都係有非常之多嘅中風嘅。
So when a patient presents to the emergency room with a stroke, they should be immediately assessed by a stroke neurologist or a person that has knowledge of stroke symptoms.
咁咧就係當個病人去到醫院嘅時候咧，第一件事咧就係個急症室裏邊嘅醫生咧，就係一係佢自己就或者個急症室裏邊有醫生係可以好清楚知道呢個病人係咪有中風咧？如果唔係嘅咧，就要即刻咧就會揾呢個腦科嘅神經科嘅醫生去做呢個判斷嘅。
As soon as they are diagnosed as having a stroke, they should then obtain an emergency CT brain scan.
咁當佢哋一決定咗呢個真係一個中風嘅症狀啊，非常之高可能係咁嘅咧，佢哋就即刻去做呢個斷層嘅腦部掃描。
Within the first 2 to 5 minutes, they're placed into the CT scanner and they get a non-contrast CT brain scan.
咁咧喺2至5分鐘啫，當呢個決定一做咗之後咧，就喺2至5分鐘之間咧，就將個病人咧就開始做呢個斷層嘅電腦掃描噶啦。咁咧就初咧就唔放嗰啲顯影劑嘅。
We then give intravenous contrast and we perform a CT perfusion scan of the blood vessels in the brain.
咁然後咧做咗嗰個冇顯影劑嘅咧，就然後再由個血嗰度咧用嗰啲靜脈咧就打啲顯影劑落去，就再影個腦嗰部分。
We then give some additional contrast and perform a CT angiogram from the brain to the chest.
咁然後咧，佢咧就會再打多一啲顯影劑落去咧，就打入嗰個血管嗰度咧，就再做多一個特別嘅掃描咧，就睇住嗰啲血管啊，嗰啲顯影劑睇佢喺個血管嗰度點樣由個腦嗰度走翻落個胸部嗰度。
So this is what a CT scan looks like in a patient with a blood clot to the brain.
如果喺呢度咧，大家咧就睇到咧，有個腦嗰度唔係好多白色嗰啲線出現啊，白色嗰啲線咧就其實就係嗰啲顯影劑喺個血管裏邊影到出嚟嘅。咁佢有一部分嘅腦咧，嗱你個紅色嘅箭嘴嗰度指住咧，就係嗰度直情都睇唔到嘅。咁所以咧就係嗰度就係冇血，即係冇血道啊。
What we are able to see on the CT scan is a blockage or cutoff of blood flow, in this case of the main middle cerebral artery, where it is blocked as compared to the normal blood flow on the other side of the brain.
咁依度你大家睇到係佢嗰條血管咧，應該係一路咁延續咁樣去咁啊，但係佢到中間一路好似切斷咗咁喎。嗰個紅箭嘴指住嗰個位咧，見唔到有血管嘅。咁即係話嗰啲顯影劑咧就去唔到啊，就係喺嗰度咧已經係可能有啲嘢塞咗，所以就冇血道啦嗰度嗰個位置。
So that is how we could rapidly diagnose that there is a blood clot in a main blood vessel to the brain on the CT scan.
咁咧就所以用呢個斷層嘅電腦掃描咧，就可以即刻係睇到個血管係塞咗，係由此而引致中風。
In addition, we also perform a blood flow or perfusion imaging of the brain, as shown here.
咁咧就佢會再做多一啲斷層嘅掃描嘅。咁你見到佢係3張圖片咧，就係將嗰個腦嘅部分咧，係將佢橫切片啊，一啲高啲，一啲低啲，咁啊切咗呢度你睇到3層，其實佢係影好多層嘅。
So the blue color represents lack of blood flow to the main tissue in the brain.
咁咧你睇到藍色嗰啲位置咧，就係冇血道嗰啲位置。
And without treatment, this entire area of the brain will die off within the first several hours.
咁如果唔即刻可以去救治呢個病人嘅咧，用我哋嘅不同嘅方法去救治佢啦。如果唔即刻救治嘅咧，就呢個病人咧就個中風就好慘啦，因為佢咁大忽嘅腦部嘅細胞咧係冇咗啊，所以佢係會有好多症狀嘅。
So we are able to perform a rapid, fast CT brain scan within 60 seconds of bringing the patient to the scanner as shown here.
咁其實影呢啲相咧，佢哋係非常之快嘅，係60秒咧就影咗。你睇住佢一路係咁樣影，一層一層一層咁樣影，應該影咗好多層嘅相噶啦，已經就係1分鐘嘅時間之內。
And by giving contrast, it allows us to track the blood flow in the brain tissue.
咁用嗰啲顯影劑咧，主要咧就睇住啲血點樣流法嘅啫。
The CT scan also allows us to directly take away the bones and the soft tissue, so we could directly visualize the blood vessels going up to the head and neck and into the brain itself.
咁呢個斷層嘅電腦掃描真係幾神奇啊！佢係可以透過嗰啲骨同埋嗰啲細胞啊，係一直咧就跟住嗰啲血液咁樣流嘅，睇到啲血液咁樣流嘅。
So here you could see we're directly visualizing the blood vessels going to the back of the head and into the skull and into the brain.
咁我哋睇到嗰啲血管咧，就係由個頸嗰度上咗去咧，就一路入咗個腦嘅中間嗰個部分嗰度，咁就一路向其他嘅腦部嘅細胞去供應血液嘅。
So this type of rapid diagnosis allows us to immediately assess all of the blood flow to the brain itself.
咁所以咧，呢個係一個非常之有用嘅檢查，係可以即刻係睇到個問題嘅所在之地。
Another imaging tool that we have to evaluate the brain for stroke is magnetic resonance imaging or MRI brain scan as shown here.
咁咧，另外一個對中風病人都有時會用嘅檢測咧，就係呢個磁性共振掃描。
And at UCSF and San Francisco General Hospital, we actually worked to develop the first integrated MR brain scanner with an angiogram room to treat stroke patients.
咁咧，東田醫生咧就話佢嗰個部門咧喺加州大學三藩市分校呢個醫學院裏邊咧，就係第一個喺美國咧係將呢個磁性共振掃描加埋呢個檢查血液嘅流動嘅做法咧，一齊喺呢個房嗰度可以做到嘅。即係通常係2個不同嘅檢查嚟嘅，但係佢哋係第一個部門係可以喺美國稱霸啦嚇，係2樣一齊做。
So the MRI or magnetic resonance imaging scan also allows us to look directly at the blood vessels in the brain and the brain tissue itself.
咁咧，你正話見到嗰個斷層嗰個電腦掃描咧，就睇唔到嗰啲腦嘅細胞噶嘛。嗱，呢個咧，佢用呢個磁性共振掃描咧，就睇到腦細胞啦喎。但係佢淨係睇到腦細胞，但係就應該睇唔到啲血管嘅。但係佢而家咧就將2個夾埋，所以咧又睇到腦細胞，又睇到血管啦。
And we can not only look at the entire surface of the brain and the blood vessels over the brain, but we could slice through the brain and look directly in different planes at the brain tissue itself.
好似睇科幻片咁啊！而家係咪？佢即係唔止係淨係睇到個表面嘅，佢係可以一層一層咁樣嚟睇嘅。即係有一個立體嘅認同啊，睇到佢係嗰個腦嗰度到底係邊度塞同埋係塞，即係邊啲細胞係受咗影響咁樣。係呢個係非常之一個非常之有用嘅成像嚟嘅，幫到啲醫生去做決策。
So this patient presented with a blood clot due to bleeding in the brain, which caused this patient's stroke, as shown here.
So where's the blood clot?
Right here, this white area.
OK， 咁你白色嗰度咧，佢咧就話呢個咧佢只係即係俾個你睇，我哋唔係喺度想學佢做嗰啲嘢，但係佢即係話俾你聽，佢喺呢度咧，佢就可以睇到邊度咧就有嚿血塊喺度阻住。OK， 嗰嚿血塊咧可以阻住啲血管，但係都可能會逼爆啲血管嘅喎，所以咧係可以2件事一齊發生嘅。
We can also do multiplanar imaging simultaneously, and this takes about 5 to 10 minutes to do the brain imaging and the analysis.
咁喺5分鐘至10分鐘之間咧，佢就真係可以全個腦啊，由上至下，由左至右，由前至後咁樣，通通睇清楚晒㗎啦。
So approximately 25 to 30% of strokes are due to irregular heart rate from atrial fibrillation causing stroke.
How many percent?
About 25 to 30%.
That's a lot, huh?
Yes.
So 大概有4分1至1/3嘅人啊，嗰個腦嗰度嗰嚿血塊啊，可能喺個心臟嗰度走咗上去嘅。
So the blood clot breaks off from the heart, and if you're not on appropriate medications, the blood clot can come off from the heart chamber and go out into the blood vessels in the head and neck and travel up into the brain and cause a stroke.
咁我唔知道大家識唔識去自己去摸一摸自己嘅脈搏啦。我哋嘅脈搏咧就應該係搏咁樣跳，就係搏，係好平均嘅。但係如果你摸你嘅脈搏嘅時候，有啲快有啲慢嘅咧，咁你就真係要揾個醫生睇下啦。因為咧就好可能咧就係因為你個心房嘅震動啊係不正常，而因為佢嘅震動不正常啊，佢咪有啲時間咪長啲係冇跳動咯。有啲時間就咁跳得好快啦嚇，有啲時間咧就好長都冇震動，但係嗰個時間咧就會形成個血塊喺個心房裏邊形成個血塊咁呢個血塊咧由於佢個震動不正常咧，個血塊就可以係上到個腦嘅。咁正話都講過啦，就係大概有1/4至1/3嘅人啊嘅中風咧，都係因為呢個咁嘅原因嘅。
So if a blood clot from the heart travels up and goes into the brain, it usually will lodge and become blocked in the middle cerebral artery as shown here.
如果係由呢個心房嗰度嗰個血塊走上個腦嗰度嗰種咁嘅中風咧，佢通常咧就去到，因為呢啲血塊咧通常都有翻咁大細咧，咁咧佢通常咧就會走到去嗰個中腦嗰條血個腦中間嗰部分嗰條血管叫中血管，咁咧就喺嗰度咧就停住塞住咗，嗰條血管係一條非常之大嘅血管嚟嘅。
Right. So when the blood clot comes into the brain, it blocks off the blood flow where the clot is located, and the entire area will begin to die off within minutes to hours from the blood clot.
咁你見到嗰個黑色嗰個位咧，嗰嚿就係血塊啦。當佢停咗喺嗰度嘅時候咧，即係話咧，佢喺個血塊之後咧，就個血咧就唔可以過佢噶啦。咁即係血塊之後受呢啲血管去俾佢哋嘅腦細胞咧，就冇血到咯喎，冇血到咧就於是成嚿嗰啲嗰個部位啊，嗰個好大嘅部位咧就會係會啲腦細胞會好快脆幾分鐘之內就會開始死亡嘅。
We know that if a blood clot goes to the main middle cerebral artery in the brain, it causes death in 30 to 35% of patients.
呢啲咁嘅血塊咧，由個心房嗰度走上去呢個中腦血管嗰度咧，係可以呢啲中風嘅人士咧，有1/3嘅人，大概1/3嘅人係因為咁死亡嘅。
If you do not die from the stroke, it causes 40% to 65% severe long-term disability.
係因為嗰個腦嘅部位咁大受咗影響啊！你睇差唔多成邊1/3嘅腦係受咗影響啦。佢係就算救得翻啊，都可能有40%至到60%半嘅人咧係會有長期嘅殘疾嘅。
And only 12 to 15% of patients will have minor non-disabling stroke.
就只有好少部分係大概1%多到1%半咁上下嘅病人咧，係嗰啲個殘疾嘅情況咧係輕微咯。呢啲就係好叻嘅病人，就係即刻一有事就即刻去醫院，就即刻去救佢。就係呢啲病人就 可能有啲即係咁好彩嘅後果咯。
And this is a autopsy study showing a patient that died from a middle cerebral artery stroke due to damage to a large area of the brain.
咁呢個其實係一個死咗嘅病人嘅解剖嘅腦部解剖，就睇到佢而家係即係個腦部嗰度咧，你見到佢正話嘅箭嘴一路咁行嗰個位咧，就係嗰啲腦細胞死亡嘅位置啦，係有成1/3咁多嘅。
So on CT brain scanning, what occurs with a large blood clot is that you begin to develop swelling of the brain tissue.
咁咧，當如果係你睇呢個掃描嘅時候咧，佢咧你就睇到咧，呢度因為嗰個血塊塞住咗嗰條血管咧，喺個血管之後嗰啲腦細胞咧，佢冇血到嘅時候咧，佢就開始會脹啊，會腫脹。
It could also cause secondary bleeding into the brain.
咁因為佢腫脹咧，佢腫脹嘅時候，佢咪可能又令到其他嘅血管去爆咯，所以咧就其他血管可能會出血啦。就係因為所以好多時咧就唔係話淨係塞咗就冇血道咁，唔係咁簡單。塞咗冇血道咧，跟住咧又另外嗰啲細胞咧就可能又會嗰啲血管咧又會爆啊，咁可能係兩種情形都有嘅。
And this combination of bleeding and swelling in the brain causes compression and death in 1/3 of patients.
咁就係因為咁咧，係會令到1/3嘅中風嘅病人咧係會死亡嘅，就係因為佢又塞住咗啦，又整到佢脹咗啦，嗰啲細胞又發脹啦，跟住咧佢又會繼續衰血啦咁，所以係一個即係不斷循環嘅症狀咯，係有一件事帶到另外一件事，又帶到第3件事，咁啊一齊發生嘅時候咧，就有1/3嘅病人係會中風嘅病人係唔可以生存。
So for in-hospital treatment, as was just stated, the first line of treatment is intravenous tissue plasminogen activator for strokes, which was first approved in 1995.
咁而家東田醫生咧又再同我哋重溫一下正話李醫生講嗰啲嘢啦，即係喺急症室嗰度做啲咩嘢啦，咁就可能俾呢個即係呢啲組織纖溶嘅酶激素啦，咁咧就係打入去嘅，就係1995年已經開始有噶啦。
In 1999, our group at UC San Francisco began to evaluate intra-arterial thrombolysis for treatment of stroke.
咁咧即係UCSF 咧呢個醫院咧，其實佢哋係真係做好多研究咯。咁喺1999年咧，佢哋都係第一個，我講佢哋應該係講我哋係咪？第一間醫院咧喺全國嗰度咧，係開始直接打嗰啲溶血劑入嗰條動脈裏邊嘅，即係上邊嗰個咧就打入靜脈嗰度嘅。OK，1995年嗰隻啊，就係打入靜脈嗰度嘅。但係咧，而家打入動脈嗰度啦，因為嗰個血塊咧係塞喺個動脈嗰度嘅。
In 2005, we began to evaluate mechanical devices to retrieve clot in the brain.
嗱，咁呢個咧就係呢個東田醫生嘅專長啦。喺2005年嘅時候咧，佢哋咧就開始去用呢個螺旋形嘅呢個咁嘅儀器咧，係將嗰嚿血塊攞佢出嚟嘅，直情入血管嗰度抽咗佢出嚟嘅。
And then in 2009, we began to evaluate sucking blood clots out in the brain.
咁到2009年嘅時候咧，就唔係用嗰個螺旋形嗰個儀器攞佢出嚟啦，就用嗰啲吸取嘅方法嚟到抽咗佢出嚟。
In 2012, we began to evaluate stent retrievers for use in removing blood clots in the brain.
咁然後到2011年嘅時候咧，就開始用嗰啲支架咧。就去嘗試用就係抽嗰啲血塊出嚟，就好似喺個心臟嗰度用嗰啲支架去抽血塊，一樣係咁嘅情況嚟嘅。大家都係一啲血管裏邊塞住咗啊嘛。
And all 3 of these devices were approved by the US FDA in 2015 for mechanical thrombectomy in patients with large vessel strokes.
咁咧喺嗰啲病人喺佢嘅大嗰啲腦血管嗰度塞住嘅時候咧，喺2015年咧就依3隻嘅儀器咧，即係抽嗰個血塊出嚟嘅儀器咧，就係由呢個美國嘅藥物食物管理局咧就係批准咗用嘅。
So currently, the state-of-the-art treatment in the hospital is clot removal by mechanical devices for large vessel occlusions.
咁而家咧就喺我哋醫院咧就係用最先進嘅做法啦，即係所謂嘅先進咧都係2015年嗰個就係最先進嘅做法啦嚇。所以我哋而家咧做大部分嘅治療腦中風嘅病人咧，就係用呢個儀器抽咗個血塊出嚟，一係用個螺旋形嘅儀器啦，一係就用個吸取嘅儀器咧，一係用個支架嘅儀器，即係用呢3個儀器嘅其中一個嘅方法咧，就係將嗰個血塊攞出嚟嘅。
So this is the modern neuroangiography suite where we perform these cases under direct X-ray. And viewing of the blood vessels in the brain.
咁呢個咧就係佢哋嗰個一個有儀器嘅手術室，咁咧就一路用嗰啲儀器咧，一路睇住個腦，一路射嗰啲顯影劑入去，就一路睇住係點樣去將個血塊抽出嚟。
So when a patient presents with a large vessel stroke in the hospital, they are brought to the angiogram suite, where we perform the procedure.
咁所以咧，如果係病人係中咗風咧，入到醫院咧，經過咗個急症室診斷咗真係中風嘅時候咧，就會即刻帶到呢啲咁嘅手術室啊，裏邊咧有齊晒啲儀器，有齊晒做手術嘅嘢，咁一齊去一路照住，一路做，一路影住相咁樣。所以咧，東田醫生咧，佢其實係一個做呢個叫做radiologist，OK， 影射嘅專科醫生嚟嘅，但係佢咧就其實係佢用個影射嗰個技術咧，就係去抽呢啲血塊出嚟，所以佢亦都係個手術醫生。
What we do is we place a small tube called a catheter into the blood vessel in the leg, and under X-ray, we guide it up through the abdomen, into the chest,and up into the blood vessels of the head and neck, directly into the brain blood vessels.
所以嗰個照像嗰個成像係個技術咧，係要非常之好先可以做到咁樣，因為嗰個成像咧就係一路睇住嗰條血管啊，喺嗰個比罅嗰度開咗個窿仔，好細個窿仔嘅啫，就插咗條管入去，就跟住嗰條血管咧就一路咁樣，即係用呢個成像一路睇住嗰條血管點樣行，就一路由個比罅穿入咗個大動脈嗰度，就上咗個心嗰度，由個心嗰度又穿過嗰啲血管咧，就上咗個腦嗰度嗰啲血管。
Once we identify where the blood clot is located in the brain, we then send this small catheter or tube directly into the blood clot to try and retrieve it.
咁當佢哋去到一個位置冇得再行啦，即係塞住咗嘅時候咧，咁佢哋咧就跟住咧就會用另外一條幼嘅管。就由呢條粗嘅管喺中間嗰度通條幼嘅管，跟住佢咁樣上去。
So this is the first generation corkscrew device used to retrieve blood clots.
呢個就係第一期嗰啲用嗰啲螺旋形嗰啲啦，即係好似開酒樽嗰個螺旋形嗰個塞咁樣啦嚇，就係將佢好似開酒樽咁樣，你當咗嗰個係塞嚟，你整過咗佢，咁你掹咗佢成嚿掹咗佢出嚟，就好似你開酒樽掹咗佢塞出嚟咁樣。
These are the current stent retrievers used to remove blood clots in the brain.
咁呢啲咧就係下邊嗰個就係嗰個鐵架啦，就係嗰個支架要嚟攞走個血塊嘅，所以唔同咗啦嚇。
So this is how the procedure works. We take a small catheter.And we place a stent through it.
係咪好神奇啊？ 嗰條血管咁幼，裏邊可以通完一條管，又通一條管，仲係中間嗰條管裏邊仲可以撐個支架出嚟嘅。所以嗰啲儀器咧，個科技咧係同呢個醫療咧係真係大家一齊去進步咯。如果冇咗呢啲儀器，根本就做唔到呢啲手術。
We do an angiogram so we can identify where the blockage in the brain is.
咁佢哋初就係用呢個打咗啲顯影劑落去啦，就然後睇到嗰啲血管邊度塞咗啦。
Once we locate the blockage in the brain, we then take a wire and catheter through the blood vessels in the brain, and we cross the clot.
咁當佢知道咗嗰個血塊喺邊度嘅時候咧，佢就首先咧就通嗰條鐵絲去到嗰個血塊嘅位置啦。
So we take under X-ray the wire and catheter through the clot as shown here.
咁你見到咧嗰條鐵線咧過咗之後咧，就跟住可以套嗰條膠管上去啦，就跟住嗰條鐵線咁樣行，就通過咗嗰個血塊。
Once we cross the clot, we remove the wire and we put in the stent retriever.
所以一步一步嘅，你首先整咗條鐵絲入去，就跟住咧整咗條膠管，套住條鐵絲咁樣行 ，OK？ 因為條鐵絲硬啊嘛，你條膠管咧就通唔過呢個血塊嘅，但係條鐵絲咧就可以通過啦。咁咧你跟住咧就整嗰條膠管入咗去，入咗條膠管通過咗個血塊之後咧，你就可以掹翻條鐵絲出嚟啦，因為條膠管已經喺度啦嘛。咁你嗰條膠管喺度嘅時候，佢因為佢粗啲啦嘛，中間有個位有個空位係咪？咁你跟住咧就佢又會再通另外一樣嘢入去中間嗰度，中間嗰個咧就可以放支架。
Once across the clot, we then open up the stent retriever to capture the clot.
咁佢通過咗嗰個血塊之後咧，咁佢放咗嗰個中間，再插多一條入去嘅時候咧，就可以將個支架撐開咗。撐開咗嘅時候咧，就成嚿血塊咧就喺嗰個支架裏邊啦。咁咧，佢然後就掹翻出嚟，咁就成個攞走。
Once the clot is captured, we then gently pull the whole device back out from the brain and back into the catheter in the neck.
就好似我正話講咁啦嚇，佢將佢好似用個網咁樣網住咗嗰個血塊，等佢唔好甩咗一嚿出嚟啊嘛，甩咗一嚿出嚟好大劑嘅。咁咧，於是咧就跟住成嚿咁樣，好似拖垃圾咁拖走佢。
And here you could see we're pulling out the clot in the brain blood vessels and removing it from the patient's body.
所以咧就成嚿血塊攞走。
So this is how we're now able to mechanically remove blood clots in the brain if we could treat them within the first 6 to 24 hours.
呢個咧就係如果病人可以係去到醫院嗰度，等佢哋可以做齊呢啲咁嘅檢查，又有呢個咁嘅時間去做嘅咧，就喺6個至24小時之內咧都可以做到呢個手術，係可以幫佢哋成嚿喺個腦塞住嗰嚿血塊抽咗出嚟。
So this is one example of a 31-year-old Chinese male that presented with a stroke.
咁呢個佢而家講係俾啲病人嘅例子我哋聽。
He presented with a large blood clot in the basilar artery in the back of his brain as shown here.
咁呢個就係喺個腦底下邊一條大血管，就佢有嚿大嘅血塊。呢個31歲嘅男士，31歲好後生。
So this blockage is shown here, and what this shows is there's no blood flow beyond the blood clot.
咁你睇到咧，佢打嗰啲顯影劑落去咧，一到咗一個位置咧，就啲血黑色嗰啲就係血啦，就好似停咗咁啊，直情過，即係過得好少啦，淨係得幾點咁過到去啦。
So this is a side view showing the blood clot in the blood vessel in the brain.
咁佢呢個咧就係打橫咁樣去影嗰個血管啦，就影到嗰嚿血塊咧，就真係差唔多成條血管塞住咗嘅。
And what we're able to do is bring a small tube or catheter up into the blood vessel and place a thrombectomy device into the clot.
咁佢哋咧就係話可以就係用嗰條鐵線咁，然後套嗰個膠管落去，咁然後就再通呢條咁嘅嘢入去，就可以將呢嚿血塊成塊攞走，成嚿攞走。
So this is another picture showing the retriever grabbing the blood clot.
咁呢個又係另外一個例子，係用呢啲儀器去將嗰個血塊攞走嘅。
And here is the blood clot removed from the patient's brain.
呢嚿咧就係真正喺個病人嗰度攞到出嚟嘅血塊啦。
And once we pull out the blood clot, you can now see that we now have opened up all of the blood flow to the brain.
咁當呢個血塊一攞走出嚟嘅時候咧，就真係好神奇咯喎！咁嗰啲血咪完全可以通行無阻咯。
And the patient has now made a full and complete recovery and is normal after 10 years.
咁呢個病人咧，佢31歲嘅時候中風係咪？咁啊，跟住當田醫生同佢掹咗呢個血塊出嚟，佢而家已經過咗10年啦，佢就即係一啲嘅後遺症都冇咯，即係同正常人一樣啦。
So in conclusion, if you are having a stroke, you need to call 911 immediately and go to the nearest stroke hospital.
所以如果各位有懷疑啫嚇，唔係真係要你確定啊，有懷疑呢個可能係一個中風嘅個案嘅時候咧，就請你立刻打911，即刻去附近嘅中風醫院，即係有可以幫你做呢啲咁嘅手術嘅中風醫院啦。
In San Francisco, there are 3 major hospitals that are equipped to perform these life-saving treatments.
咁喺三藩市咧就有3間大嘅醫院咧係可以做呢樣嘢嘅，即係佢呢種咁嘅手術啦。一個咧就係加州大學舊金山分校嘅醫療中心啦，一個咧就係舊金山總醫院啦，一個咧就係太平洋治療中心。
This includes UCSF Medical Center, San Francisco General Hospital, and CPMC Medical Center.
OK， 就係呢3間醫院啦。
If you are having a stroke, you should go to the nearest emergency room that is capable of treating stroke, and you may be given intravenous TPA for treatment.
咁如果係中咗風之後咧，就應該嗰啲救傷車咧就會車你去最近你屋企嘅醫院嘅，就等你可以攞到呢啲即係血塊嘅溶酶啊激素嚇。
But again, if you are not improving after the TPA, you may be a candidate for endovascular therapy to snare the clot out from the brain.
咁但係咧，有啲血塊好大塊噶嘛，或者你可能係已經過咗個4.5個鐘頭嗰個時間咧，咁咧就嗰啲病人咧就應該係送去呢3間醫院嘅其中一間啦，就可以將嚿血塊攞出嚟。
This treatment, if successful, may significantly improve your overall neurological outcome at 90 days.
咁做呢種咁嘅手術咧，係可以非常之成功嘅，係可以將呢個神經系統喺90日，即係3個月之內咧，係得到顯著嘅改善嘅。
So ideally, this is how in-hospital patient care should be managed in the following video.
咁所以咧就係呢個希望就係可以做到咁樣嘅咁完善嘅治療啦。
Can I call you right back? 5 minutes? Okay, great. Thanks so much. Bye. Somebody help me.
There's no evidence of hemorrhage, so it's probably a clot.
It's too late for TPA.
It can cause brain bleed if it's done after 3 hours.
咁正個女人咧講完電話暈咗，咁而家去到醫院嗰度啦，個醫生即刻同佢 check 呢個斷層腦部掃描。
Our assessment, we're supposed to take a chance.
Well, what are other options?
I hope that collateral flow can develop, get her into physical therapy. With a major stroke like this, chances of a meaningful recovery aren't good. The only other option is the Mercy.
What?
It's a catheter retrieval system. Takes you into the brain through an artery. Allows you to corkscrew the clot out.
And it reverses the stroke completely?
It's not without risks.
The stroke affected the language center of her brain, so she can see and hear, but she cannot communicate. Do you want us to go ahead with the procedure?
Say yes.
What happens if we don't do it? Well, her heart condition is treated, but she won't improve neurologically. But she won't die.
No, Dan, listen to what he's saying. This other thing might fix me. Please, this once, hear me.
Oh my God. Ellie?
Give consent. Please.
Okay.
Fluoro on.
Torquing clockwise.
Injecting.
Cross your fingers. 1, 2, 3.
10 cc's in.
You got it? Pulling back. Got it. Beautiful. Fully recannulized. No fragments in the distal branches. Wide open. Wake up, Ellie.
Can't sit her up.
Want to try and say something?
Thank you.
Okay, thank you very much.
Thank you so much, Randy. That was an outstanding presentation. I always appreciate the visuals and the videos to get the points across. Someone posed the question, would the San Francisco stroke centers take patients from ERs outside of San Francisco? And yes, absolutely, that's the case. In fact, we have patients transferred from all over Northern California to UCSF, for instance, for this treatment.
咁個朋友Ray 咧就話我哋會唔會收啲唔係喺三藩市嘅病人啦？咁當然係任何病人都會收啦，即係嚟得到我哋醫院，我哋即係我相信間間醫院都係啊，你去病人帶得到去嗰間醫院，嗰間醫院就即刻會收嘅，唔會拒絕病人。
Another question posed is, should we give aspirin to a patient before the ambulance arrives? Is that a good choice? In general, we would, if the question is someone with stroke symptoms, there's a chance that those stroke symptoms could be from bleeding rather than from a blood clot. And so we can quickly assess that in the emergency room and then give aspirin.
咁呢個朋友咧就話，如果即係時間嘅問題啊嘛，佢話如果係屋企嗰度有人好似中咗風咁樣，好唔好俾啲阿士匹靈佢？因為阿士匹靈係稀血藥啊嘛，係咪？咁大家好多人都知嘅。咁佢話好唔好首先俾粒阿士匹靈佢頂住先啊？即係如果個救生箱未嚟嘅時候，咁金醫生咧就話，因為中風咧係有兩個原因噶嘛，可以係失血管，亦都可以係爆血管噶嘛。咁如果係假如梗係唔好彩，呢個病人中風係爆血管嘅，你俾粒阿士匹靈佢食喎，咁咪仲大件事咯。所以佢話穩陣起見咧，你都係等嗰啲救傷車嚟咗，然後帶佢去醫院先做呢件事。即係我哋要查清楚佢唔係出血啦，咁樣先俾得嗰啲稀血細佢嘅。So obviously you've been doing this for ages, right? So how many thrombectomies have you done?
Well, we're averaging about 120 to 130 thrombectomies per year. And we've been doing this now for the past, since 2015.
咁東田醫生話咧，自從2015年嘅時候咧，已經開始做呢種咁嘅儀器抽嗰個血塊出嚟嗰個咁嘅手術㗎啦。佢話大概一年都係做百幾個嘅，100、2、3、4個嘅，所以係相當多咯，即係每個月都有幾個做嘅，平均嚟講。
But Dr. Kim and I'm sure Dr. Lee are evaluating many more stroke patients in their emergency rooms as well.
咁佢話Dr. Kim 同 Dr. Lee 就當然係見多啲更見多啲中風嘅病人啦。Dr. Lee, you actually had commented before to me that many of the patients they arrived at Chinese hospital, there's very little that you can do for them. And why?
Yeah, thank you. That's a good question. So, as we mentioned, when you present to the emergency department is very important, and we want to see you as soon as possible. And what we're seeing with many of our patients is that many people are presenting days late. Their symptoms have started and they think that they're going to get better at home on their own. So they don't come into the emergency department right away. And because of that, we aren't able to give them treatments like TPA or send them to UCSF for embolectomy. So the sooner you can come, the better it is.
咁李醫生咧就話，好多時啲病人咧唔係話中咗風佢即刻入嚟醫院，可能隔咗幾日啊，可能係1個禮拜之後先入嚟嘅。咁你隔咗咁耐咧，嗰啲醫生咧就真係無能為力啦，因為已經太耐啦。So why do you think they don't come in right away? What was the reason from what you know?
Well, I think many patients aren't exactly sure what's going on, and they think that they're going to get better on their own. They think that, they'll be able to wait and see their doctor and schedule an appointment with their doctor. I think those are usually the reasons that they don't come in right away. Perhaps they don't know that there is a treatment that can be offered to them within 4.5 hours or within 24 hours.
So 李醫生咧就話，好多病人咧都唔知道有呢個黃金嘅時間嘅，係可以喺呢個黃金時間之內咧，如果你係入到嚟醫院，係可以幫到你嘅，就算中風都可以幫到嘅。但係實際上咧就係好多病人咧都係對呢個中風呢樣嘢，我哋講出嚟好似好容易咁樣話，如果咁樣就係中風啦，如果咁樣有可能係中風啦，可能啫。但係咧病人咧好多時咧有個僥倖嘅心態嘅，就係話可能啫，但係可以唔係噶嘛。或者唔係咧，或者嗰啲症狀會走咧，咁真係可能會嘅喎，因為有啲係嗰啲小中風咧症狀咧，佢可能24小時之內個幾個鐘頭咧就消失咗啦。佢咪話咁咪係咯，我都話唔係㗎啦，所以唔使去醫院嘅。咁佢仲自己慶幸添，但係就唔知道咧呢啲咁嘅小中風咧就可能會引致大中風嘅。So when these patients when they thought that they were not having a stroke, and as a matter of fact they could be just having a transient ischemic attack. And the symptoms come and go. And then in a few hours, it went away. And so they were happy. They probably thought that they made a right decision not to go to the emergency room because, see, look, the symptoms are gone. But little did they know that this might predispose them to more strokes. So Dr. Kim, what is the situation in patients who have TIAs? What is the chance of them having a major stroke when they don't take care of it?
Yeah, so there's a high risk of stroke after a TIA. So even if the symptoms go away, the risk of a stroke in the next 90 days can be as high as 10 or 11%. And half of that risk is within the first day or two. And so TIA is just as much of an emergency as a stroke and should be treated aggressively.
咁金醫生咧就話你即係如果呢啲小中風咧，佢小中風即係話個症狀咧24小時之內咧就自動消失嘅，可能幾個鐘頭之內就冇咗噶啦。咁咧如果你唔理佢嘅時候咧，你唔好慶幸得咁快，因為咧呢啲小中風嘅症狀咧，即係其實係話俾你聽，你個腦裏邊係有啲問題嘅，有啲血塊嘅問題嘅，係咪？咁如果你唔理佢咧，有一個大啲嘅中風嘅機會咧，係有喺1-2日之內係會有1成嘅機會，你係會有一個大中風嘅。所以，但係你如果係小中風嘅時候，你攞咗呢個機會去將佢呢個問題解決咗嘅時候咧，咁咪唔需要中風咯。即係可以避開嘅呢個問題係中風唔係一定會發生嘅，唔係一定要發生嘅。 We have another question here from Esther. How many years of training? Oh, maybe she has a son or somebody who wants to become a neurologist. Wants to find out how many years training.
Dr. Higashida, you want to handle that question? It's about how much training to become an interventionalist.
After graduation from medical school, it's usually between 8 to 10 years of additional training, which includes a residency program in radiology, neurology, or neurosurgery, and then 1 to 2 more years of after residency of fellowship in diagnostic neuroradiology and angiography. And then at UCSF, 2 more years of additional fellowship training. So at our program, it's very academically oriented, and it's a total of 9 to 10 years.
That may be discouraging for some people to hear.
You come out very well trained.
Yeah.
And very poor. With a lot of debts from schools and all that, right? So I'm just teasing. But it's certainly a very important specialty, because without physicians like Dr. Higashida, many of the stroke patients would have died, right? Or would not have recovered so well. So we thank you for all your work, for your good work. And we thank you, Dr. Jessica Lee and Dr. Anthony Kim, for all the important work that you do. And especially now that Chinese Hospital is trying to get the stroke center certification, right? You're going to get this month, I heard.
Yes.
Yeah, that'll be great. Well, it'll be the good news for people who live around the Chinatown area, because then you'll be that much faster getting in the hospital. You know, the ambulance could come and take you. Please don't walk there. Please don't have your family drive you there. Please call 911 so that you can get there. See, because when the paramedics come, they are already starting doing work for you. They started communicating with the physicians in the hospital already. So work is starting the minute they arrive. So it's very important that you do that instead of waiting for your son or your daughter to come home or to come to visit you before you come in. And that's where we see a lot of times, and it's a big no-no. 請你哋唔好等你嗰啲仔啊女啊放工或者嚟探你嘅時候先去醫院啊！你覺得你自己可能有啲中風嘅症狀嘅時候咧，你就自己請你自己打91，錯咗都唔緊要㗎，冇人會打你㗎。錯咗咪翻屋企咯，但係唔會將佢自己條命嚟交飛係咪啊？如果係啱嘅咧，啱嘅係可以救咗你條命嘅喎，係咪啊？所以錯冇所謂啦，錯咪錯咯。係咪啊？所以咧就希望大家喺今次呢個講座之中係學到一樣嘢，邊樣嘢啊？打911 ，OK？ So Dr. Kim, anything else to say to round up, or Dr. Higashida and Dr. Jessica Lee? Anything else to say before we say goodbye for today?
Well, thank you very much for sponsoring this, and it's of great benefit to the public and to the community. So thank you very, very much for your organization.
Thank you for the good work that you do. So we just passed that, and so we thank all the speakers, Dr. Kim, Doug, Ada, Dr. Lee, Gina, and Dr. Higashida. You did a wonderful job today. We want to thank all of you. 咁我哋多謝各位嘅醫生同埋講者係咁樣，係我哋亦都多謝Cliff 同埋Raymond 嚟到喺背後幫我哋嗰啲 technical stuff 嗰啲技術嘅問題。咁咧，我哋咧就當然係要多謝各位嚟參加啦。如果冇咗你哋嚟參加嘅，我哋做呢個講座都唔成功啦，係咪？ So we want to thank all for coming, and we look forward to seeing you again. Thank you. Thank you all.
Thank you. Thank you, Diana. Thank you, everyone.
Bye-bye.
Thank you.